Hi, figured I'd come on here and give a little bit of an update. Today is September 3rd. I guess it's almost September 4th. It's kind of in the middle of the night. I had my surgery a week ago on Thursday, the multi-level Acdf, and I'm doing a lot better. Still have pain, still taking my Percocet about every 3 hours, unfortunately, with the Valium every, 6 or so hours. And unfortunately, I get a lot of pain behind my shoulder blade, which seems to be the worst, which is a little strange. But overall, it is better. I'm happy that it is getting better. And the collar, people complained about the collar. It doesn't bother me at all. It's like a security blanket. It makes me feel safe. I like having it on. You know, I can arrange it. It doesn't have to be too tight. This is actually the tightest I usually even wear it. I can leave it a little looser than this. I just make sure I pile up all my pillows behind me when I'm sleeping, and I don't have to sleep as upright as I was a couple days ago. I'm a little more on a slant now. It would have been nice to have a recliner, but that didn't work out in my case. But if you are unable to get a recliner for your surgery, it is not the end of the world. Just make sure you have a nice stack of pillows. You know, make sure they're neatly stacked so they don't go haywire when you're sleeping. But, I had a good 10 pillows on my bed, and I feel like I needed every single one. Sometimes just sitting there watching TV, I'd have one arm propped up on a couple just to alleviate, because I do have that strange pain in the back of my shoulder blade, and that helps alleviate some of that. And, but I'm moving around a lot more. I've left the house a couple times. I mean, I had to go. Normally, they wouldn't let you leave the house, to go out in a car the first couple days, but I had really bad episodes of high blood pressure in the hospital. They needed me to go get that checked. And it seems as of now that it was just, I guess, me freaking out being in the hospital, or maybe the Dilaudid, caused me to have such a high blood pressure. But it seems to have gone back to normal. And, I don't have to worry so much about that now. And I can talk better. You can hear in my voice. I mean, my daughter was laughing at my other video. She was like, you sound so drugged. And I'm really on no less drugs now, but it's just that my throat has, the swelling has gone down and everything. So I can talk a little more clear. It doesn't cause as much strain. It doesn't hurt as much. And everything. Like right now, I don't know if you can tell, I keep switching arms because my one arm is starting to hurt talking. But it is getting much better. I'll take the collar off just a tiny bit so you can see. I've had this awful rash since the hospital. And I don't know what kind of glues they used. I don't know what all that is. It sometimes itches and drives me crazy. But that is just from, it started in the hospital, I guess, whatever. Some of it was sticky, and I had a lot of these little, like, weird sticky patches to me. And they're slowly going away, but they don't bother me as much. And I guess I can show you a little bit of this. It's kind of nasty. Don't want to pull too hard. But it's swollen out to here. It's like, that's my skin. That's not bandage bunched up under there. That's like a whole, I don't know, bit of egg-shaped something or other. I don't know if I can do this on camera because it looks a little gnarly, but not as bad as, I don't know, expected yet. Let's see. Give you a nice look. It's not great. Eventually, I'm only showering every other day. I don't have the strength yet. And I'm not really getting that dirty anyway. So, let's see if I can do I might not be able to do this one-handed. That was silly. Oh, maybe I can. Not so terrible. Yeah, the collar is really, I was really afraid of it because I had a small car accident a week and a half before the surgery, which freaked me out. And I'm sure that didn't help with my blood pressure situation. And they had me in one of those awful hard collars that the EMTs use which they have to use for protocol. And I completely understand. Years ago, before I started with my back trouble, I was an EMT myself and loved it. But I was so afraid that that collar was an indication of how I was going to feel. And luckily, this collar is really, it's really not that bad. And I can shower without it on, even though I try to leave it on as much as I can, because I just don't like the way it feels. Bending my head forward, it's not so much, but if I tilt my head back at all, it just feels really strange. And for now, I prefer to just leave it nice and still. I see the doctor on the 9th. I know after that he's going to discuss starting the physical therapy, which should be soon after that, which would be nice to start working on, getting everything going. I still, I can't lift anything, can't lift my cats, I can't bend over and feed them, kind of thing. So it's a little rough not being able to do the normal stuff around the house. But sometimes I don't even notice that the time's going by, because between the medication I'm on, plus your body's tired when it's healing, and it needs that sleep and rest and everything. So it's okay. I mean, it's nice when I have enough energy to watch a TV show and make it through, because that kind of stinks when you can only watch 5 minutes of a show at a time. That was a little lame, but that's all right. But I'm trying to think of important things that would help people. I really don't know. I know I was one of the in upper pain scale when it comes to the surgery, but most of the people who have the surgery are getting 1 or 2 levels done. I had 3. So once you get into the higher levels that they do surgery on, that alone just puts you into a tougher recovery and everything with the pain. And but I mean, I haven't seen my doctor yet, so I can't say anything from that end of it. I know the surgery itself went very well. Apparently there was a ton of arthritis in there, and to think of what they had to do to get rid of it, it's not pleasant, because they pick off pieces that stick out and then they shave it down. It's kind of nasty, but it's gone, and it should give me a lot of relief in the future. So hopefully, I don't know. My spirits are much better. I'm doing a lot better. If this is a surgery you're facing, definitely consider it. I mean, obviously I'm not a doctor. I can't give medical advice. I fought against having the surgery for the longest time. My first time I got hurt was in 1998, and I had a car accident. My husband was driving, and we got rear-ended pretty bad in our minivan, and I had a herniated disc from that. And over time, I've just deteriorated between herniated discs, arthritis, degenerative disc disease, spondylolisthesis, and I have some of this going on in my low back as well. So one of these days I'll probably need a little surgery down there as well. I did have nerves removed from the lower back. That helped a little bit for a while, but it gets hard to walk sometimes, because when you have spondylolisthesis, it pulls on, I think it might be the sciatic nerve. I'm not entirely sure on that, but it pulls on it, and it makes it like I'll get stuck walking mid-stride and I just can't. So that would be nice if in the future they could also fix that, and I can be all one piece again. But I'll take half for now. Like I said, if anybody has any questions about the surgery, help with the decision making, like obviously I have to be careful with what I say, because I am not a medical professional. I took the long way around. It took a long time for me to say okay, because I was terrified. I was completely terrified of having this surgery. And I did have a couple days in the hospital of pain that were part of what I was afraid of. And they were bad. They were pretty bad. But I got to the point where the damage being done to my spine, and the potential damage that could be done to my spine. I mean, anytime I would just jar myself, if I tripped, if someone bumped into me, if I moved my neck quickly the wrong way, I could go into a 3-day massive migraine, and that's no way to live. And that's when I knew that it was getting time to buckle down and not be scared, and go ahead with the surgery. And the reason I'm making YouTube videos, even though they suck, because I'm not, basically my second YouTube video is right this one here, is I watched a lot of people's stories about their progress and their recovery from the Acdf surgery, and seeing these people, even there was a couple that had a tough time as well, but most at an easy time. Like, easy is the wrong word, but comparatively easy to what the surgery is. And it made me feel so much more comfortable to know that, you know, it's something you can live through. It's something that will help. It may take some time for full strength to come back in my arms and to stop dropping everything and all that. It could take a good year. Some things, depending on the rate of nerve damage and how long, you know, the nerve damage was there. Some things may be permanent. I can't say I can, it's hard. I don't know. I just, there just seems to be more flow into my fingers and more, you know, I feel a little stronger that way. I just feel like there's, you know, I guess the pressure's off whatever was compressing those nerves, and I'm starting to feel benefits already. And it's only been a week, little, you know, week and a day, and I think it's awesome. So if I forget to say anything in these videos, because like I said, I kind of do them impromptu because I do get very, very tired, and sometimes just the thought of planning out a video, I just get overwhelmed and I'm too exhausted. So I just kind of had a moment. I was home alone. It was nice and quiet and have to, you know, be embarrassed about someone overhearing me speak to my camera. So I just picked it up to talk for a little bit. But like I said, if anybody does have any questions, please feel free to ask. I will do my best to answer or send you in the right direction for an answer if it is something as a medical, as a non-medical professional I can't answer for you. So I'm just glad I'm doing better, and it's, you know, we'll see once I can, you know, start driving. We'll see when I can start doing that. But walking around the house is great. It's just little movements here and there. Just walking around is just, it's good for the blood flow, good for the legs, and, you know, I guess I'll talk to you guys soon. Bye.